the time amongst yourselves. Andy Carter.
Thank you, Ms McVeigh. I'll do a very quick calculation.
You've got quite a few minutes.
It's a pleasure to serve under your chairmanship, and I'm delighted to follow the honourable member for Westmoreland and Lonsdale, and I congratulate him on securing this really important debate and pay tribute to his excellent opening speech. And I have to say I agree with many of the points that he made in there. This is an incredibly important issue for families up and down the UK, and I'm really delighted to be able to join him and speak in it today. I want to start, Madam Chair, by thanking those who work in oncology in Warrington, the consultants, the nurses, the radiographers, and, of course, GPs who are right at the front line, the primary gateway into cancer services. Their work has continued through the pandemic, as has the work of those working in this sector right across the UK. Early on, I recall speaking to Professor Simon Constable, who's the Chief Exec of Warrington Hospital, who outlined to me the steps his team were taking to try and maintain cancer care services in as near normal fashion as possible. Their ability to operate across 2 campuses with a COVID-free site in Halton meant that procedures such as breast cancer could operate as very close to normal as possible. And the partnership that they formed with Spire Hospital at Stretton in Warrington, where the NHS had contracted bed space and use of their operating theatres to give capacity for critical operations, has meant that referrals for urgent treatment in Warrington has continued. Now, I sometimes think that when you talk to real people, our real constituents, you hear the true stories. And on Friday last week, I spoke to a constituent called Helen, who lives in Lymm, and it was one of the more pleasant conversations I've had with her over the last few weeks. Very sadly, she discovered that her breast cancer had returned in April. It was actually the same week that we hit the peak of the first wave, and very understandably, she was incredibly concerned when she contacted her GP. She was referred back to a consultant, and after tests was told she needed a double mastectomy. Now, I remember talking to her earlier on in the year when she told me the news and explained in real detail about her fears of catching COVID when she went into hospital to get some radiotherapy and to undergo some tests. She was being asked to isolate and to follow really detailed guidance. And I have to say she was superbly cared for by her son at home, who really went out of his way to make sure that everything she needed she had. She went into hospital in Halton for treatment, and last week, some 8 weeks after the operation, told me she was looking forward to going back to work as a supply teacher in one of our local schools. Her description of the care she received from the NHS, I have to say, was incredible. She said they could not have done more for her. And I want to highlight this story because I actually think we haven't heard enough about the work that has continued over the last few months. But that doesn't mean we don't have a problem with cancer care services. Now, because of COVID pressures on our local hospital, and Warrington at the start of November was treating 170 patients for COVID. It was one of the most under pressure hospitals in the entire country. The team have only been able to operate at about 80% of normal services. And I say only at 80% of normal services. I think that's actually pretty good, given we're in a global pandemic and roughly it's in line with services across the northwest of England. But I suspect, though, that 80% headline actually masks a lot of the true worrying statistics that we're going to discover over the next 5 years. Last week, I also spoke to executives at Macmillan Cancer about the local situation in Warrington, as well as the national picture. And I paid particular tribute to the Macmillan nurses who've continued to work with patients in their homes through lockdown, particularly those who've supported families of loved ones who've neared their end of life. Now, Macmillan estimates that across the UK, there are currently around 50,000 missing diagnoses, meaning that compared to a similar time frame last year, when you scale back, around 33,000 fewer people across the UK started treatment compared to 2019. And this backlog of undiagnosed cancer could take around 18 months to tackle in England alone. Most worryingly, if cancer referrals and screenings don't return to pre-pandemic levels, the backlog could grow by almost 4,000 missing diagnoses every month, reaching over 100,000 by October next year. Now, as I've said, during much of the pandemic, the NHS has been open for business, and we should be proud of that. And anyone who needs care and treatment can continue to access it. When you need it, you can go to your GP and you will be seen, especially where delays could impose both an immediate and long-term risk. But I think, though, that most worryingly the stats is related to the number of urgent GP referrals in July and August this year. They were 72,000 lower than last year. And in some ways, that really highlights the most stark problem that this pandemic is storing up for us. 2020 has seen a significant reduction in people starting their cancer treatments. In total, between March and September, around 31,000 fewer people started their first cancer treatment, a drop of 17% compared to 2019. More than 650,000 people with cancer in the UK have also experienced disruption to their cancer treatment or care because of COVID-19. And for around 150,000 people, this included delayed or rescheduled cancer treatment. Now, I welcome the announcement of £3 billion of extra funding to support NHS recovery from COVID-19 and to help tackle and ease some of the pressures that will certainly be there in all of our hospitals and allowing them to carry out more checks and scans and operations and procedures. This will help to ensure that cancer patients are able to access the care that they need quickly as possible. But we need to tackle the backlog, and we can't afford to undo the great work and investment that's gone into cancer treatments in recent years. And I have to say, I'm delighted to be speaking in a health debate today because the news that we've heard that an authorised vaccine is on the way and has been approved is incredibly welcome. But we have to put this alongside the challenges that exist in every single branch of medicine, and particularly in cancer care, where the patient backlog is extending. One of the biggest challenges we face today isn't caused, though, by money or pressure on NHS services. It's the problem which occurs by putting things off. And it's a problem that we all do, mainly due to a fear of going into hospital. As I mentioned when I talked about Helen earlier, she talked about her greatest fear of going into hospital. So lumps and bumps aren't treated because we think it doesn't really matter at the moment. And I'm afraid that's particularly true for us men. And that's been highlighted because of this pandemic. We really do need a public information campaign that if you spot a problem, don't leave it for a later date. Now, as my honourable friend, the member for Westmoreland and Lonsdale raised, the survival rates since 2010 from cancer have increased year on year. We've a really good story to tell in this country. Around 7,000 people are alive today that would not have been here if mortality rates had stayed the same. But to sustain that drop, the NHS and government are going to have to take action in a way that they have never done before. So it's critical that the cancer workforce is ring-fenced against any further redeployment to ensure that cancer care continues and further unavoidable cancer deaths are averted. The number of NHS specialist cancer nurses before the pandemic was around 3,000, which Macmillan modelling indicates is around 2,500 below the required level to deliver basic cancer care. And given the backlogs, it probably is now more closely to 3,500. And patient feedback to Macmillan was that though their nurses were working incredibly hard, they're actually not getting the support that they need. Now, I really welcome the 14,000 additional nurses we've recruited in the last 12 months, and the additional £260 million fund allocated for Health Education England in the one-year spending review is very welcome, and it will go towards the government's commitment to train 50,000 more nurses. However, my honourable friend, the Minister, will know that this alone isn't going to address the significant shortfalls in specialist cancer care nurses. So I'm really keen to hear from the Minister how the government can commit to further long-term funding support for the next iteration of the NHS People Plan to eliminate the gap in the cancer workforce. It's hugely important that the government back the National Cancer Recovery Plan and the additional resource needed to build capacity and help beat the backlog now and in the long term. Getting the right skills and resources in the right places to make sure we can have the biggest impact possible, and most importantly, encourage people to get the treatment that they need. Getting all of us to feel comfortable with reaching out to our GPs early on so that we can get the treatment has to be our number one priority.
Tonya and Tony.